Atresia refers to this obstruction, or maybe even an absence of a lumen or a passageway. Biliary has to do with the bile ducts or gallbladder. So biliary atresia is when there's some sort of blockage, deformity, or even a total absence of a bile duct. Biliary atresia specifically refers to newborns or young infants, and it can be a congenital defect, meaning something that happens during fetal development, but more commonly it's some sort of inflammation that happens soon after birth that leads to the destruction of the bile ducts. There isn't a definitive cause of biliary atresia, but it's generally thought that some viral or toxic substance might induce the inflammation. Some genetic mutations have also been suggested, like a mutation in the CFC1 gene, which is involved in the development of the left-right embryonic axis. At any rate, the mechanisms and pathogenesis are still pretty foggy, and it likely depends on a combination of genetic and environmental factors. Newborns with biliary atresia usually develop jaundice. Since there's some destruction or deformity of the bile ducts, eventually there's an obstruction to bile flow, right? And bile will start to build up. Pressure in the ducts will increase, and that bile will eventually push its way through the tight junctions between the epithelial cells lining the ducts and leak out into the blood. This increases the amount of conjugated bilirubin in the blood, which leads to this yellowing of the skin and eyes. Although not the most common cause of neonatal jaundice overall, it is the most common cause of neonatal jaundice that's surgically treatable, and early recognition of the disease improves the effectiveness of the surgery. Typically, the surgical procedure used for biliary atresia is called the Kasai procedure. And basically what's done is the damaged bile ducts outside the liver are first removed, and then the small intestine is cut and one end is directly reattached to the liver where bile comes out, also where the bile ducts used to be. This allows the bile to drain directly into the small intestine. The other end of the small intestine is reattached to another spot along the small intestine, such that now there's this path from the stomach to the small intestine, as well as a path for the bile to drain from the liver. Although this procedure can be effective at reestablishing some bile flow, a lot of newborns continue to have slowly progressing liver disease and will often need a liver transplant by 2 years of age.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more